Wendell, how are you doing today?
I'm good. How are you doing today?
I'm good, thank you. So today we will be using a tool known as DHQ, which is also known as Drug History Questionnaire, in which there are 13 different categories of drugs. I'm going to ask for the number of different substances and request you to share if you have used them or not in the past 12 months. And for the substances that you have been using in the past 12 months, then we are going to further referring back to the time anchor of 90 days, and then we can discuss further questions which can include questions like the typical amount of the substance on each day in the past 90 days, and like when have you used the substance lastly, and all those questions. Is that okay for you?
Yep.
Also, you have the calendar here. You can refer to it if you have any confusions about the time frame.
Okay, for sure.
Yeah. So it basically measures the quantity and frequency of the drug use, if any, for the last year and mainly past 90 days. Do you have any questions so far?
Not right now.
Okay, I just want to remind you that if you have any questions during the assessment that we are having today, you can just stop me at any time and then we can further reflect your question. Is that okay?
Yep.
Yeah. Can we start now?
Yeah.
Okay. So, have you been using alcohol, which includes beer, liquor, or wine, for the past 12 months?
Yes.
Okay. Have you consumed cocaine or crack, like coke, in the past 12 months?
Yeah, I clearly remember I did cocaine for recreational purpose for like 5 years ago, but now I don't use it.
Okay. Have you been consuming amphetamines or any other stimulants which can include methamphetamine or Adderall for the past 12 months?
Yes.
Okay. Have you consumed cannabis, which includes hash, weed, grass, pot, marijuana, or oil for the past 12 months?
Yes, a lot.
Okay. Have you consumed benzodiazepines, which can include Xanax, Valium, or Librium in the past 12 months?
No.
Okay. Have you consumed barbiturates, which can include butabarbital or pentobarbital in the past 12 months?
Never.
Okay. Have you consumed heroin or opium for the past 12 months?
I clearly remember no.
Okay. Have you consumed any prescriptional opioids, which can include codeine, fentanyl, or methadone for the past 12 months?
No.
Okay. Have you consumed any over-the-counter codeine preparations, which can include oxycodone or Tylenol, in the past 12 months?
No.
No. Okay. Have you consumed any hallucinogens, which can include acids, mushrooms, or DMTs in the past 12 months?
Never.
No. Have you consumed any glue or any other inhalants in the past 12 months?
No.
No. Have you consumed tobacco or nicotine for the past 1 year?
Yes, I did.
Okay. Have you consumed any other psychoactive drugs except for the ones that we have already mentioned in the past 12 months?
No.
Okay. So now for the substances that you mentioned that you have used them in the past 12 months, we can further reflect on the time anchor of 90 days, and here's the calendar. Already I told you about this, and you can refer to this if you have any confusions in the dates. Okay. Yeah. So you mentioned you have been using alcohol in the past 12 months. So have you used it in the past 90 days?
Yes, I have.
Okay. What are the number of days that you have used alcohol in the past 90 days?
I'm not sure. I drink probably 3 to 5 times a week, sometimes closer to 4 times a week. I'm not sure what that works out to be in 90 days.
Okay, so you just mentioned that you have been consuming alcohol for like 4 days a week, and then we are counting like for the past 3 months, which counts like from the yesterday. So it's like 13 weeks. So it's gonna be 4 days a week into 13 weeks, which counts out to be like 52 days. Is that okay for me to say that you have been consuming alcohol for 52 days in the past 90 days?
I think so.
Okay. Okay, so when was the last time that you consumed alcohol?
I guess I last drank 2 days ago.
2 days ago. Okay, so can you refer to the typical amount on each day of use in the last 90 days?
I drink about 7 to 10 beers, but like maybe it's closer to 10 beers a day.
Okay, 10 beers a day. So when have you actually started using alcohol?
I have been drinking alcohol for like past 4 years, but
Mhm.
now it's cause I stopped my meth like for regularly, you know.
Oh, okay. Okay. So you mentioned that you have used amphetamines in the past 12 months. So have you used them in the past 90 days?
Yes, I have been using it occasionally,
Mhm.
but now on weekends.
Okay. So what are the number of days that you have used amphetamines in the past 90 days?
I may have used about 20 times in like past 3 months.
20 times in past 2
3
months?
months, yeah.
Okay. So when was the last time that you that you consumed amphetamines?
I clearly remember it was like about 2 weeks ago.
2 weeks ago?
Yeah.
Yeah, okay. So what is the typical amount on each day of use in the last 90 days?
I use a half gram to a 1 gram like each day.
Okay. So do you have any past relationships with using amphetamines, as you mentioned using it occasionally now?
I don't use it as much as I did it in the past. I was using it regularly like when I was like 21 to about 26 years ago, but then I stopped because I was feeling some symptoms which was interfering in my daily life.
Okay, as you mentioned that you were like facing some symptoms that were interfering in your daily functioning, can you describe those symptoms to me?
I was feeling agitated. I had the shakes. I was like really irritable, like easily, and sometimes I get paranoid. And I don't know if you're gonna believe it or not. Sometimes I see or hear things which were not there. So that's why I stopped.
Okay.
And after that, I started using it again after 2 years, like when I was 29 years old.
Okay. So as you mentioned, you have used it after, like you have started using it again after 2 year break. So what led you to start using it again?
Seriously, actually, I don't remember really, because I used meth when I'm together with my friend Marcelo, and sometimes I smoke it and sometimes I snort it.
Okay. So you also mentioned that you have used cannabis in the past 12 months. Have you consumed them in the past 90 days by any chance?
Yes, I have.
Okay. What are the number of days that you used it in the past 90 days?
I smoke up about 4 to 6 times a week, sometimes 4 times, other weeks 5 times. Like I think it's gonna be probably around 65 days in past 3 months.
Okay. So when was the last time you consumed cannabis? I'm sorry.
The last time I used it's like last night because it helps me to sleep better, you know.
Okay. So what is the typical amount on each day of use in the last 90 days?
About half a gram daily.
Daily?
Smoke it in a water bomb or I vaporize it.
Okay. So when did you started consuming cannabis?
I started using it when I was 15. Yep.
Okay. Have the amount intake changed in these years?
No, it's been pretty much the same since I started.
Okay. Also, then you mentioned that you have consumed tobacco in the past 12 months. So have you consumed it in the past 90 days?
Yes, I have.
Okay. So what are the number of days that you consumed tobacco in the past 90 days?
I think it's gonna be 25 days or something in the past 3 months.
So is that okay for me to say that you consumed tobacco for the past for 25 days in the past 90 days?
Yeah.
Okay. So how long have you when was the last time that you consumed tobacco?
I don't really remember that.
Okay.
Yeah.
So what is the typical amount on each day of use in the past 90 days?
About 10 cigars on weekend days. Like usually when I drink, that's when I smoke a lot.
Okay, so 10 cigars on weekend days?
Weekend days, yeah.
Okay. So do you have any past relationships with tobacco?
Yeah, I smoked every day when I was an older teenager, but I don't really smoke much now.
Okay.
Yeah.
Okay. So how do you perceive the relationship, as you mentioned, between smoking and usage of any other drugs?
Sometimes I smoke poppers mixed with the weed and smoke cigarettes while I was drinking on weekends.
Okay.
Yeah.
So that's it for our drug history questionnaire. So do you have any questions so far?
No.
Okay, so thank you so much, Wendell, for discussing it with me and giving me your precious time. Based on your responses, I get that you have engaged with various substances, which includes alcohol, amphetamines, cannabis, and tobacco. It is encouraging to note that you have retained from cocaine use for the past year, showcasing your commitment to change. Moving forward, we can work collaboratively to address your goals and your journey towards well-being.
Thank you.
Yeah.